Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 17th of December 2022 OET exam, in which I would like to discuss with you all about OET writing. Okay, so let's move on to the case note. Before that, I would like to inform to you all there are different types of letters in different countries. So here I would like to discuss with you all about the OET writing, especially what question paper was given in India. Okay, so based on my students' informations and what question paper they have got it, that is the question paper I'm going to discuss with you all. Okay, so let's see the case note. Actually, the patient was a 78 years old patient. Patient was under community nurse home visit as per the patient's GP's request. Patient is in a stage of recovery stage of pneumonia. So the doctor, patient's GP requested the nurse to make a home visit to check the patient's recovery process, how the patient is getting on at home, and is the patient is compliant with the medication or not. So when the nurse started to do a home visit, so during the home visit, she came to know that the patient is somewhat suffering with like kind of vein issues, like venous problems, and she was thinking that something is wrong with the patient. So that she is asked the patients that what exactly happened to the patient. During the visit, patient is saying to the nurse like he was traumatized 6 weeks ago, and that he forgot to say to the doctor when he gone to his own GP for the review of his condition. When the nurses made a home visit, and she came to know that patient is somewhat suffering with a vascular problem, and also patient is complaining of the pain and numbness, weakness, and redness over the limbs. And based on the assessment, the nurse came to know that patient might have venous insufficiency. Thereby, the nurse is writing an urgent letter to the vascular unit manager for the further treatment and management of the patient, and also to confirm the diagnosis of the patient. And apart from that, patient is having hypertension, high cholesterol, diabetes, and also patient is suffering with some more underlying conditions, and also he is taking medications for the same. So this is the case note. So here we are just coming to the point of like exactly how to write a case note. So here we are writing an urgent letter to the vascular unit manager for the further treatment and assessment of the patient. Okay, so as usual, we are writing the date on the top of the letter, and also address to whom we are addressing this letter. So that person address has to be mentioned. And when you are writing an address, the first letter of the each word should has to be capital letter. And then writing the salutation. So we are writing dear sir or madam. If they have given the name, we are writing the surname of the patient, surname of the receiver, and using the title Mr. or Mrs. And now reference. So there you are writing a patient full name and the date of birth or age of the patient. Now introduction. So here introduction, we can say that Mr. X, who is suspected to have venous insufficiency, full stop, he requires your urgent assessment and management. That's it. Now coming to the point of present medical history. So which one I have to give more importance? So the importance is since the day first of the home visit to until the today's visit, what was happened to the patient, and how the nurse identified, and what was the complaints of the patient, how the patient is expressed, and assessment what the nurse has found out from the patient condition. This all has to be elaborated in a concise and a clarity manner. So we can start the letter like this. Mr. X has been under my home visit as per his GP since the day one. So what is the date the patient was under her condition? And during my visits, the patient was found to have so and so complaints. On assessment, he was noticed to have venous insufficiency, possibility of venous insufficiency, like that you are. And also patient stated that he had a traumatized 6 weeks ago, and he forget to reveal to his GP during his visit. So these things has to be mentioned in the present medical history paragraph. And coming to the point of social background. So what is his occupation and what is the underlying conditions? Like as I mentioned earlier, the patient has diabetes, hypertension, high cholesterol, and a few more conditions also he is suffering with, and also what medication he is on. That all has to be elaborated as much as possible in the social background. Now, recommendation paragraph. So what they have to do, it is an urgent referral, isn't it? So it has to be mentioned like, it would be appreciated if you could take over Mr. so and so or Mrs. so and so for further assessment, diagnosis and treatment as you feel appropriate, because she is suspecting, even she is not confirming that one. So it will be like assessment, diagnose and treatment as you feel appropriate in the recommendation paragraph. Okay, and then you are coming to the conclusion, and then you are winding the letter. If they have given the name, you are sincerely. If they not given the name of the addressing person, yours faithfully. So it was a simple referral letter, and it is easy to write it. I hope you have all done in a very good way, and hope for the best result. And whomever wants to join in our class, we are running mock batch crash course, and 10 days, 20 days and 30 days, and also 40 days, 60 days classes for the beginners. We are only having an online classes. Whomever wants to join in our class, you can contact us anytime. Our number has given in our description. Okay, so until then, bye bye, and all of you, happy Christmas.